My name is Dr. Brenda Mosi. I'll be presenting my dissertation on prevalence and presentation patterns of nystagmus in children attending the pediatric ophthalmology clinic in KNH, Nairobi. My supervisors are Professor Ilako, Dr. Bore, and Dr. Njambi. A quick nystagmus definition is abnormal, involuntary, rhythmic, rapid to and fro movements of the eye. It can be infantile or even acquired. So part of the reason we did this study was because there's no known published data on the prevalence of nystagmus in Kenya prior to this study. So my broad objective was to describe the prevalence and presentation pattern of nystagmus in children seen in the KNH clinic in Nairobi, Kenya, between the period of January 2018 to December 2018. So the specific objectives were to describe the characteristics of the type of nystagmus seen in our patients in the clinic, and also to determine the cause of nystagmus in children's, the causes of nystagmus in these children. So this is a retrospective study done in the KNH Pediatric Ophthalmology Clinic, as we said earlier. Inclusion criteria was all patients less than a year to 18 years of age with the nystagmus seen in the clinic in 2018. Our exclusion criteria were patients missing critical data relevant to the study. Of note, we did not exclude any patients. So sampling of the population, we took all the files of the patients below 18 years of age. They were retrieved and included in the study. So some of our data variables included demographic data, which was age at the time of clinic visit, age at the first diagnosis of nystagmus, and the sex of the patient. We also looked at the diagnosis of the underlying conditions and the characteristics of the specific nystagmus. So the results, our total number of patients was 606. 83 of these 606 had nystagmus, and giving us a prevalence of 13.7%. So in terms of our presentation patterns, there was no gender predilection in terms of male and female. They were equal, as you can see. Age at first diagnosis of nystagmus, we used, these were 83 patients. As you can see, most of our patients were first diagnosed between the age of 1 to 5 years with a mean of 2.5 years. Most patients presented with poor vision, giving us a percentage of 31.3, followed by 25.3% of them having abnormal eye movements. And this is a multiple entry table, so some of the patients had more than one complaint. In terms of the nystagmus patients with strabismus, only 38.6% of the patients had strabismus, which was in keeping with another study done in Minnesota Olmsted, in which also they had a lower number of patients having strabismus. In terms of abnormal head posture, as you can see, 84%, which is the majority, did not have abnormal head posture. In terms of anterior segment findings, as you can see, most of our patients had normal anterior segment findings on examination. So as you can see, 63.9% did not had normal anterior segment findings. So this is in keeping with the Olmsted study as well, in which 92.1% of their patients had normal anterior segment findings. So in terms of posterior segment findings, 50.6%, which was the majority, had normal posterior segment. You can see the ones with abnormalities were fewer in terms of percentage. This is also in keeping with the Olmsted study. In terms of characteristics on examination, so directionality, the most common was horizontal at 77.1%. In terms of waveform, Jackie was the most common, 47%. 54.2% of them had low amplitude, and 39.8% of them had a resting point, which made the majority. 32.5% had low frequency, and 56.6% their nystagmus was conjugate. So in terms of associations, the most common nystagmus association we found was nystagmus associated with the ocular diseases at 28.9%, followed by the fusion maldevelopment nystagmus at 25.3%, then the neurological nystagmus at 16.9%. In terms of ocular comorbidities, as you said, there were the majority, 61%. And the most common was the manifest strabismus, followed by congenital cataracts. In terms of systemic comorbidities, fewer had systemic comorbidities, so they were 47%, And of this 47%, the majority, which was 43%, had cerebral palsy, followed by hydrocephalus at 28.2%, and then rickets at 28.2% as well. So in terms of management of the underlying comorbidities, as we said, most of our patients presented with poor vision, and on examination, quite a number had refractive errors. So the most common management prescribed for the patients was spectacles. This was prescribed for 21 of the patients, giving a percentage of 25.3%. And this was followed by visual stimulation for 19 of the patients, giving a percentage of 22.9%. As you said, most of our patients presented with cerebral palsy, hydrocephalus, and later they could develop cerebral visual impairment, which was also associated with the nystagmus. So some of the limitations we experienced were some files had incomplete or missing data. However, we used all the data we could extract from the files, so no file was excluded. So in conclusion, our prevalence of nystagmus was found to be high in our population at 13.7%, which we could explain with the fact that KNH is a tertiary referral center. It's actually the largest referral center in Kenya. So we receive all patients from all over the country, which could have given us a higher prevalence. Most of the patients with nystagmus presented with poor vision. The mean age of first diagnosis was 2.5 years with no gender predilection. So in terms of recommendations, we recommended that we should come up with a standardized or customized tool for recording the nystagmus. We could also sensitize medics both in our clinic, eye clinic, and in the other clinics, for example, the neurosurgical, neurology, pediatrics clinics, to refer the nystagmus patients for prompt visual assessment, early diagnosis, and early intervention. Thank you.